Hi, I'm Austin from the University of Maryland Charles Regional Medical Center, and welcome to Facebook Live. Today we're here at Charles Regional Rehabilitation in La Plata, talking about running injuries and how to prevent them. Joining us is outpatient physical therapist Amal Bakre, who is not only our running expert, but is also a passionate runner himself. In addition, one of Amal's patients, Matt, will be helping us with some demonstrations. Amal, Matt, thanks for joining us today.
Thank you.
For everyone who's watching, feel free to ask questions in the comments section below and let us know you're watching by liking our video and sharing with your friends. Let's get started. Amal, tell us a little bit about why you chose this topic and why running injuries are so common.
Thanks, Austin. Good afternoon, everyone. So the reason I chose running as our topic of interest today is running is such a common form of sports training nowadays that you go out there every other month, there is another 5K or 10K or even a full marathon happening, which is awesome. But with every kind of fitness training comes a physical stress, and running is a repetitive impact activity on the ground, so it does affect us from starting from the toes all the way to the hips, even our low back, and if you consider upper body as well. So we call this whole chain as a kinetic chain or a kinetic link.
Thanks, Amal. So how do we strengthen our kinetic link?
So it's a little funny word because it's all interlinked. We call it as little connections all together, helping us to move faster as a part of running. If there is an imbalance between these muscles, if the muscles are too tight or if they're too weak, then it's going to cause the injury. That's as simple as that. So in order to understand these injuries better, I think we can focus better from thinking about low back perspective first. So why back pain is so common? Now Matt here was a patient for us for the back pain as well, so it's easy for him to correlate. Because we need a strong base for us to propel forward. If the base is not strong, then with each repetitive impact, it's going to alter your mechanics of running, and then you're going to get a stiff back or a little loose back. That's why it is important to kind of focus on the low back injuries.
So Amal, when a runner comes to you, what aches and pains do they come to you with, and what exercises do you recommend for them?
Yeah, so as part of our physical therapy practice, we see a lot of runners coming with the low back issues, and they generally say, it starts hurting when I initiate my run, or after a mile or so, my back feels so stiff that I feel like cracking it. But just generally, don't crack it. It is best to talk to a therapist so we can address those issues pretty well, and then get your running performance better. Like we talked about the imbalance, if your core is not strong, you're going to get starting with your back pain. So the best way to train your core is to do a simple exercise. We call it as plank. So Matt, you've done planks before, right?
Yes.
Awesome. All right, so let's get you into the plank position. You're going to put your elbows down and put your feet out. Good. All you got to focus here is tuck your tummy in and squeeze your butt muscles. There you go. This is the easiest way to work your upper body, your core, and even your butt muscles. You can progress them either by holds or by adding the upper body movements and adding the leg movements. Awesome. Good job, man. Perfect. We can go back.
Thanks. Thanks for your help, man. So we've covered ways to strengthen our lower back and our core. Now let's focus on lower limb joints, including our hips, knees, ankles, which are the next along our kinetic link.
Yeah, so the most common injuries runners have when they start talking about their thigh pain is we call it as IT band syndrome. Now what exactly is IT band? If I can show it on the mat on the right hip, it starts all the way from the back of your hip area going down to the knee. Now why these injuries are so common is because if we don't have enough strength in this muscle, we call it as hip abductor muscle, or if we have tight hamstrings, or if our buttock muscle is too tight. That causes these muscles to overact and then starts frictioning, which hurts. So the best way to work it out is to do a little bit of stretch. We call it as a run and stretch, especially during warm-up. If we consider right side is in pain, then I generally go with putting the right leg behind and stand as how Matt is standing, cross-legged, and you want to bend down, trying to touch that right foot. There you go. Awesome. Do you feel that stretch right in here, Matt?
Yeah.
Awesome. Good. And we can come back up. You can hold it and progress it as you need it. Another way to work or mobilize our IT band is by using a foam rope. It's something we have it available in the every gym and stuff like that. Easy for training. So again, considering the right side is in trouble, I'm going to put it right in here, and let's have you lie on it on your right hip area. There you go. Excellent. Going on your elbows. Would you mind move? There you go. Excellent. And all you're going to do is roll your body back and forth. There you go. And back again and forth. You feel the pressure?
Yeah.
Awesome. Good. Perfect. And we can actually use the same principle for the different muscles, which are your hamstrings. We can use the same foam roll, or we can use the buttock area as well to roll that out.
Thanks, Amal. And it looks like we have some questions from our viewers. Assisting us today with questions is Laura from our marketing and communications team. Laura?
Hi, so it looks like we do have one question so far. They've commented saying, I've recently started training for a marathon and I've started getting cramps in my stomach area after about a mile or so. What do you think this is and how can they make it feel better?
Great, that's a great question. It happens to me. I'm sure it happened to Matt when he started running. It's so common to have these cramps, and generally when you start running and if you're getting it, then basically they're because you drank too much of water or electrolytes before. So I would generally suggest to sip it instead of gulping it so that your tummy will not get full and your muscles will not start talking to each other. The other way is if you're running a lot and it starts cramping it up, the best way is to start focusing on your breathing muscle. We call it as diaphragm, which runs right along the part where your tummy and chest divides. You can focus that by breathing in through the nose and out through the mouth like you blow the candle. As you're running, don't stop running. That's how I guess cramps can be addressed pretty well. So, yeah.
Great, thank you so much, and thank you, Laura. So to wrap up today's session, let's talk about foot pain and problems for runners.
Yeah, so foot pain is so common because runners, the first thing they think about what kind of shoes they should wear to avoid that pain. Now there are so many shoes out there in the market that we don't know which one is the best and how to choose and stuff like that. So I generally kind of suggest to choose what works best for your foot type, and if you know how to tie a good knot, then you can do that job of running pretty well. So for now, we kind of brought, Matt was helpful enough to bring his shoe here because he runs quite a lot, as you can see. Easy way to kind of self-analyze your shoe is this. You look at from the back side. You see the outside edge and the inside edge. How much wear and tear do we have here? That shows how much runner is weight bearing side to side, which needs to be corrected. The second thing I want to look at it is the midfoot area. If this is too shrinky, that means the arch inside is too supportive, or if it is too broad, then you have very little support. That's something you want to look at it based on your foot type. And then we see is this mobility, we call it as a forefoot mobility. If it is too sturdy or if it is too flexible, it will help us in running in any way, how much, depending upon your foot type. Generally if this is too mobile, it does help the runner, but if it is too sturdy, it helps some of the runners if they have too much of a loose foot. So I guess that's how we can address the foot pain. Yeah.
Thanks, Amal. And as we wrap up for our viewers today, what are some last pieces of advice you can provide?
Yeah, so again, the first thing that we talked about is to correct the imbalance between the tight muscles and the weak muscles. Me and my colleagues, we recently had a chance to go to a cross-country run, which turned out to be a cross-country. Actually, it was supposed to be a flat ground run, so we all were sore the next day. And this is what happens if you don't know the surface. So make sure you train yourself in the right surface if you are aiming for a good marathon. And also remember that cross-training helps a lot, so do not just run. Strengthen your back and core muscles and your tummy.
Great.
Yeah.
And how can viewers today connect with you on physical therapy exercises and tips for running?
So running is such a common sport, like we talked. So the injuries are common as well. So don't get afraid. It's going to happen to you if you're really training yourself. But we are here to help you with those if they happen to you in your run. So give us a call at 301-609-5494, or you can visit our website at umcharlesregional.org. And we can sit and talk and discuss more about your running programs.
Great. Yeah. Thanks a lot, Amal, and thank you, Matt, for being with us today. And thank you to all of our viewers who watched. If you have any additional questions, please leave them in the comments section. We'll be happy to answer. Thank you so much.
Awesome.